patient today is an otherwise healthy 22-year-old who presents for a non-surgical extraction of tooth number 30 to relieve pain and improve function. I previously saw this patient for a consultation visit, and she is here today for the procedure. So our patient is ASA Class 1 with no medical complications, and therefore it is safe to provide treatment today. How are you doing today?
I'm doing good.
So you're here for an extraction, correct?
Mm-hmm.
Of your lower right.
Yes.
Yeah, perfect. Okay, so after taking your blood pressure, I looked at what I wrote down, and your blood pressure is 120/80. And her pulse is 60, and her respiratory rate is 10, and her temperature is 98.6. So these vitals are consistent with what we've taken before in our consultation, so I think today you're ready for procedure.
Okay, perfect.
So have you ever had an extraction before?
No, I haven't, so I'm kind of nervous.
You're a
right
little
now.
nervous? Okay,
Mhm.
well, so it's okay to be nervous. There are several things we can do to help alleviate the anxiety. Would you like me to go through some of the aspects of the procedure with you?
Yeah, that'd be great.
Okay, so you want to know what you're concerned about, correct?
Yeah. Mm-hmm.
Well, there could be bleeding, facial pain, swelling, trismus, which means opening the jaw, and those are just like some of the major concerns. And depending on how much discomfort you're in, we may be able to use over-the-counter pain meds, or we may prescribe something a little stronger. We'll also give you instructions about how to manage your post-operation procedure and what to do, and they will give you gauze after. So the bleeding should stop the day of the extraction, so if it doesn't, you should call us immediately.
Okay.
Swelling is normal for the first couple days, 2-3 days, and if it concerns you a little bit, just give the office a call. We don't expect any systemic complications with you because you don't have any bleeding disorders. You don't have CVD or metabolic disorders, so I don't think you'll have any contraindications to the medications we'll give you.
Okay.
Okay. Do you have any other concerns?
No, I think you covered everything.
Okay. Also, given the condition of your tooth, the pain may worsen and you may develop an infection or abscess because if we didn't extract it. So this is the best case this will help you, and this will be a huge benefit to your oral health.
Okay.
Okay?
Thank you so much.
No problem. Well, so now that you're comfortable with the procedure and we've discussed everything about the procedure and all the complications, and I've answered all your questions, correct? Okay, so this is the consent form for the extraction. I know you already looked it over earlier, so can you please just give me a signature unless you want to read more?
No, I think.
Okay. Okay, thank you. Anesthesia was successful. We completed an inferior alveolar nerve block of the lower right. It was successful because we probed the center of the lower lip and the patient was numb. And additionally, we performed endo-ice on the buccal surface of tooth 30, and it was patient didn't feel a thing, so it was successful.
So I'm going to be talking about the armamentarium today. So this is the bite block. This is basically going to be used for jaw stabilization. Then we're also going to be using the mouth or throat screen, which is basically a 4x4 gauze. This is to prevent aspiration of any dental particles. And this gauze is also for hemostasis control after the extraction. Then we're going to have our Minnesota cheek retractor. This is just to help retract the cheek on the working side. Then we also have the periosteal elevator. This is to reflect the soft tissue and release the periodontal ligament around the tooth. Then we're going to move on to the small straight elevator and the large straight elevator, and both of these are just to help elevate the tooth. Then we have our universal mandibular forceps, or 151, and this is to luxate or rotate the tooth around the socket. Then this is the double-ended curette, and this is to remove debris and granulation tissue from the socket and basically scoop everything out at the end of the extraction. Then we also have the monojet syringe and the cup to hold the saline in, and this is just to debride the socket of any other debris. So for this procedure, we're going to be putting the patient in a semi-reclined or 30-degree supine position.
Let me get my laptop just to make sure that so do you want me to be the patient? Yes.
Okay. So this supine position basically helps to reduce the chance of a vasovagal incident or fainting, and leaning the patient back also helps to ease their anxiety. So the seat and my seat need to be in a position where the occlusal plane is parallel to the floor, And the chair has also been lowered for proper visualization and leverage. And basically I should be at a position where my arm is inclined downward approximately 120 degrees. Because we're working on tooth number 30, it's going to be in close proximity to the inferior alveolar nerve. So we have to be careful of the nerve, and we have to make sure to look at the pre-op radiographs to help guide us and prevent damage. We also need to make sure that we don't damage any of the adjacent teeth, as well as the floor of the mouth, and we have to make sure we don't damage the inferior alveolar nerve as well as the mental nerve. So now I'm going to go over the armamentarium and how it's going to work on the procedure and on the patient. So first, I'll talk about the bite block. This is basically going to go on the opposite side, the non-working side, and this is just to stabilize the jaw and help the patient keep the jaw. So we're going to be using a 4x4 gauze, and this is basically put at the base of the mouth against the cheek and the tongue, and this is just to serve as a throat screen to prevent aspiration of any small dental debris and particles, as well as to help with any of the hemostasis control. Then we also have the cheek retractor, and this is basically to keep the cheek away of the patient so that my visualization can be clear. So now I'm going to move on to the periosteal elevator, and using this end, basically we have to go 360 degrees around the tooth number 30, and this is basically to loosen up the soft tissues around the tooth and make sure that the next step is a little bit more comfortable for the patient. The next instrument that we're going to use is the tooth elevation. It's for tooth elevation. It's a small straight elevator, and it's basically to make space. So the serrated edge of these instruments are the ones that are going to be placed against the tooth that we're extracting. So using a finger rest, we're going to be placing the small elevator on the mesial surface of the tooth, and then we're going to turn against resistance. And then we're going to repeat the same thing on the distal aspect of the tooth and turn it against resistance. This basically helps the buccal and lingual plates expand. And once we turn the small elevator without resistance, then that is when we move on to the large elevator in the same manner. This is the large elevator, and again we're going to be doing the exact same thing that we did with the small elevator, but this just has a bigger working side, and we're going to be working again on the mesial side of the tooth and working it to get against the resistance, and then on the distal side, and again working it against the resistance, and we'll keep doing this until we can move the large elevator around the tooth without any resistance. This is the mandibular forceps, and again it's the universal forceps, or 151, and it's basically applied on the mesial and then the buccal, the mesial, the buccal, and then the lingual. And the point of this is to seat it as apically as possible, and then we use the figure 8 movement to rotate the tooth, and then you take it out towards the buccal side of it. The tooth has been extracted. I'm going to observe the apices of the teeth and their orientation just to make sure that I didn't miss anything in there. Then we're going to move on to the double-edged curette. And after the tooth has been extracted, the double-edged curette is basically used to gently release any granulation tissue, soft tissue debris, and additional particles from the site. Then I'm going to use saline with monojet syringe with suction to gently irrigate and wash out the socket to make sure that it's nice and clean. After the tooth has been removed and the socket has been treated, I'm going to remove the throat screen and then fold a new piece of gauze into a square for the patient to bite down on in the socket, and then trade the bite block for the bite gauze, basically. You want to make sure that the patient can bite down comfortably and that the jaw has not been dislocated. So do you feel okay? Yeah. Bite down fine? Mm-hmm. Okay. So just make sure that you maintain the pressure of the gauze, and just leave it in there for about 20 minutes, and then you can take it out.
Okay. Thank you.
So the extraction is now complete, and you've been biting down on the gauze for the past 20 minutes. And now I'll talk to you about post-operation instructions. And everything that I'll tell you right now is also listed on the post-op instructions on the form, on the walkout form that I'll give you before you leave as well. Firstly, I just wanted to talk to you about medications and pain management. So this extraction was non-surgical, and because of that, if you're otherwise healthy, prescription medication and antibiotics are not going to be required. And just to know what to expect, it's normal to experience some discomfort and some bleeding post-operation, so just know to expect that. And the reason for that is that the local anesthetic has epinephrine that I gave you, and it's meant to control the bleeding, but as the anesthesia wears off, bleeding will increase in the next hour or so. And to control this, I'll give you some extra gauze. You can fold it, place it over the socket, and bite down for 20 minutes. And you can do that for 3 cycles. And if after an hour you're still bleeding and you're still concerned, call the emergency number that's listed on the form, and also give me a call as well.
Okay, thank you so much.
Also, another thing, swelling is after surgery is also common, and it's normal to develop into tonight or even into tomorrow. So 12 hours after surgery, and it may last 2 to 3 days. And to help with this, you could use an ice or a cold pack on your face for 20-minute cycles, in 20-minute cycles for 24 hours as well, just to help with the pain and swelling. It also shows on Axiom, your chart shows that you're not allergic to ibuprofen or Motrin, so I would advise you to take ibuprofen on your way home or after leaving before the local anesthesia starts to wear off in about an hour, hour and a half. And you can continue to take ibuprofen every 4 to 6 hours, and preferably with food as well.
Thank you.
Okay, so we talked about those things. In terms of food, there are certain types of food that you should avoid, especially things that are difficult to chew, so things like baguettes, nuts, whole apples. Those are things that you should avoid, and you should try to eat softer meals for now, such as scrambled eggs, jello, and fish. And I would avoid chewing until the right side of your tongue is no longer numb, and this is just to avoid biting it on accident. And it's also important not to eat or drink hot foods or drinks or spicy food, and it's important to also avoid rinsing, spitting, or using straws. And in terms of maintaining oral hygiene and brushing, you should just brush normally, but don't scrub the site of the surgery. Just use a mirror to help with this as well, and you shouldn't floss in the area to avoid irritating the gums in that area as well. So just as a recap, we talked about medication, pain swelling management. We also talked about diet choices and maintaining oral hygiene instructions. And despite all those instructions that are also that I just gave you and that are also listed on the walkout form with you, if anything changes, or if you're concerned, or worried about your condition, or even a possible infection, please call me. And in an emergency, it's really important that you call the number listed on the form. And just for the video purposes, it's 212-998-9660. And so back to the patient. Do you have any questions?
No, I think you covered everything. Thank you.
Okay, so we will give you the walkout form on the way to the front desk on your way out, and I'll see you in 1 week for a follow-up appointment just to see how things are going. And if you have any questions or concerns, you have the contact number for emergency as well as the contact info for me on the paper, and I will also call you tonight to follow up with you to make sure you're okay.
Thank you.
Yeah, all right.